Dizziness. It's a sensation most of us have experienced at some point, that fleeting moment of lightheadedness after standing up too quickly, the slight unsteadiness after a particularly intense workout, or the brief disorientation following a roller coaster ride. These occasional episodes are often harmless and resolve on their own, chalked up to a temporary disruption in our body's equilibrium. But what happens when dizziness becomes a frequent, unwelcome guest in your life? When those fleeting moments stretch into persistent periods of unsteadiness, significantly impacting your daily activities and overall well-being? Before we delve into what to do about frequent dizziness, it's crucial to understand exactly what we mean by the term. Dizziness is a broad term encompassing a variety of sensations often described as lightheadedness, faintness, unsteadiness, or a spinning sensation. It's important to differentiate it from vertigo, which is a more specific type of dizziness characterized by the distinct illusion that you or your surroundings are spinning or moving. While vertigo is a symptom of an underlying condition, dizziness itself is a symptom that can stem from a multitude of causes. Think of it like a headache. It can be caused by something as simple as dehydration or something more complex like a migraine. The experience of dizziness can be incredibly unsettling. It can range from a mild annoyance to a debilitating condition that interferes with your ability to work, drive, or even perform simple tasks around the house. The unpredictable nature of dizziness can also lead to anxiety and fear, further compounding the problem. The constant worry about when the next episode might strike can create a cycle of stress and anticipation that exacerbates the underlying condition. Occasional dizziness is usually nothing to worry about. A sudden drop in blood pressure after standing, orthostatic hypotension, a minor head cold, or even skipping a meal can trigger a brief spell of lightheadedness. These episodes are typically short-lived and resolve quickly without any intervention. However, frequent or persistent dizziness is a different story. When dizziness becomes a regular occurrence, it's a sign that something is amiss and warrants further investigation. The key takeaway here is to understand the difference between transient, occasional dizziness and persistent, frequent dizziness. If you find yourself experiencing dizziness multiple times a week, if the episodes are lasting longer than a few minutes, or if the dizziness is accompanied by other concerning symptoms, it's essential to take it seriously and seek medical advice. Don't dismiss it as just one of those things or try to tough it out on your own. Frequent dizziness can be a sign of an underlying medical condition that requires diagnosis and treatment. Think of your body as a complex machine with intricate systems working in harmony. Dizziness is often a signal that one of these systems is out of sync. It could be a problem with your inner ear, your cardiovascular system, your nervous system, or even a combination of factors. Identifying the root cause of your dizziness is the first step towards finding effective relief. In the following sections, we'll explore the various potential causes of frequent dizziness, discuss when it's crucial to seek immediate medical attention, and provide practical self-help strategies for managing mild dizziness. We'll also delve into the medical evaluation process, outlining what to expect during a doctor's visit and discussing the different treatment options available. Finally, we'll address the challenges of living with chronic dizziness and offer coping mechanisms and support resources to help you navigate this often frustrating condition. Our goal is to provide you with a comprehensive understanding of dizziness, empowering you to take control of your health and make informed decisions about your care. Remember, you're not alone in this. Dizziness is a common problem, and with the right approach, it can be effectively managed. Let's embark on this journey together and explore the steps you can take to regain your balance and improve your quality of life. Now that we've established the importance of distinguishing between occasional and frequent dizziness, let's delve into the potential culprits behind those unsettling spells. Understanding the possible causes is crucial in determining the best course of action and seeking appropriate medical attention. Dizziness, as we've discussed, isn't a disease itself, but rather a symptom that can arise from a wide range of underlying conditions. These conditions can affect various parts of the body, from the inner ear to the brain, and even the cardiovascular system. One of the most common and often overlooked causes of dizziness is dehydration. Our bodies are composed of approximately 60% water, and maintaining adequate hydration is essential for proper bodily function. When we're dehydrated, our blood volume decreases, leading to a drop in blood pressure. This, in turn, can reduce blood flow to the brain, resulting in lightheadedness and dizziness. Simple activities like sweating during exercise, spending time in hot weather, or not drinking enough fluids throughout the day can all contribute to dehydration-related dizziness. Another frequent offender is low blood sugar, also known as hypoglycemia. Glucose, derived from the food we eat, is the primary fuel source for our brain. When blood sugar levels drop too low, the brain doesn't receive enough energy to function optimally, leading to symptoms like dizziness, weakness, and confusion. This is particularly common in individuals with diabetes who are taking insulin or other medications that lower blood sugar. However, even those without diabetes can experience hypoglycemia-related dizziness if they skip meals, engage in strenuous exercise without proper fueling, or have certain underlying medical conditions. Medication side effects are also a significant contributor to dizziness. Many medications, both prescription and over-the-counter, can cause dizziness as a side effect. These include medications for high blood pressure, anxiety, depression, seizures, and even some antihistamines and pain relievers. If you've recently started a new medication and are experiencing dizziness, it's important to talk to your doctor or pharmacist to see if it could be a contributing factor. They may be able to adjust the dosage or recommend an alternative medication. Inner ear problems are another major cause of dizziness, particularly vertigo. The inner ear contains a complex system of canals and structures that are responsible for maintaining balance. Conditions like benign paroxysmal positional vertigo, BPPV, Meniere's disease, and vestibular neuritis can disrupt the normal functioning of the inner ear, leading to dizziness, vertigo, and other balance problems. BPPV, for example, is caused by displaced calcium crystals in the inner ear, which trigger dizziness when the head is moved in certain directions. Meniere's disease is characterized by episodes of vertigo, hearing loss, tinnitus, ringing in the ears, and a feeling of fullness in the ear. Vestibular neuritis is an inflammation of the vestibular nerve, which transmits balance information from the inner ear to the brain. Anxiety and panic disorders can also manifest as dizziness. When we're anxious or stressed, our bodies release hormones like adrenaline, which can trigger a variety of physical symptoms, including dizziness, rapid heart rate, and shortness of breath. In some cases, dizziness can be a primary symptom of an anxiety or panic attack. The feeling of being out of control or disconnected from reality can also contribute to the sensation of dizziness. Migraines, known for causing severe headaches, can also be accompanied by dizziness, even in the absence of head pain. This type of migraine-associated dizziness is called vestibular migraine. The exact cause of vestibular migraine is not fully understood, but it's thought to involve changes in brain activity that affect balance and spatial orientation. While the causes we've discussed so far are relatively common, it's important to be aware that dizziness can also be a symptom of more serious, albeit rarer, medical conditions. These include heart problems such as arrhythmias or heart failure, neurological disorders such as multiple sclerosis or stroke, and even certain types of tumors. However, it's crucial not to jump to conclusions or self-diagnose. The vast majority of cases of dizziness are not caused by these serious conditions. It's best to consult with a doctor to get an accurate diagnosis and rule out any underlying medical problems. In summary, the potential causes of dizziness are vast and varied, from simple dehydration and low blood sugar to more complex inner ear problems and anxiety disorders. There are many factors that can contribute to those unsettling spells. Understanding the possible causes is the first step towards finding effective relief and taking control of your health. In the next section, we'll discuss when it's crucial to seek immediate medical attention for dizziness, as some symptoms can indicate a serious underlying condition that requires prompt treatment. While we've explored a range of potential causes for dizziness, it's paramount to understand when dizziness signals a medical emergency. Dizziness, in and of itself, can be unsettling, but certain accompanying symptoms elevate the situation from concerning to critical, demanding immediate medical attention. Recognizing these red flags can be life-saving. It's crucial to remember that if you experience any of these symptoms alongside dizziness, don't hesitate, call emergency services or get to the nearest emergency room as quickly as possible. Time is often of the essence in these situations. One of the most alarming symptoms that can accompany dizziness is chest pain. Dizziness coupled with chest pain can be a sign of a serious heart problem such as a heart attack or angina. These conditions occur when the heart muscle isn't receiving enough oxygen-rich blood, often due to a blocked artery. The dizziness in this case can be caused by the heart's inability to pump blood effectively to the brain. Chest pain may feel like a squeezing, tightness, pressure, or aching sensation in the chest. It may also radiate to the arm, jaw, neck, or back. Difficulty breathing is another red flag symptom that should never be ignored. When dizziness is accompanied by shortness of breath, wheezing, or a feeling of not being able to catch your breath, it could indicate a lung problem such as a pulmonary embolism, a blood clot in the lungs, or severe asthma exacerbation. In these situations, the dizziness is often caused by a lack of oxygen reaching the brain. Weakness or numbness, particularly on one side of the body, is a strong indicator of a possible stroke. A stroke occurs when blood flow to the brain is interrupted either by a blocked artery, ischemic stroke, or a ruptured blood vessel, hemorrhagic stroke. The lack of blood flow deprives brain cells of oxygen and nutrients, leading to brain damage. Dizziness, along with weakness, numbness, and other neurological symptoms, is a hallmark of stroke. Other stroke symptoms include sudden confusion, trouble speaking, vision changes, and loss of coordination. Slurred speech is another key warning sign of a stroke. If you're experiencing dizziness and find it difficult to speak clearly, or if your speech sounds garbled or mumbled, it's crucial to seek immediate medical attention. Slurred speech, like weakness and numbness, indicates that the brain isn't functioning properly due to a lack of blood flow. Vision changes, such as sudden blurred vision, double vision, or loss of vision, can also be a sign of a stroke or other serious neurological problem. Dizziness accompanied by vision changes should be evaluated immediately by a medical professional. Loss of consciousness, even for a brief moment, is always a cause for concern. If you experience dizziness and then faint or pass out, it's important to seek medical attention to determine the underlying cause. Loss of consciousness can be caused by a variety of factors, including heart problems, seizures, and severe dehydration. In addition to these specific symptoms, any sudden, severe dizziness that is unlike anything you've experienced before should be evaluated by a doctor. Don't try to diagnose yourself or wait to see if the symptoms improve on their own. It's always better to err on the side of caution when it comes to your health. It's also important to consider any underlying medical conditions you may have. If you have a history of heart problems, diabetes, neurological disorders, or other chronic illnesses, you may be at higher risk for experiencing dizziness with serious underlying causes. Be sure to inform your doctor about your medical history and any medications you're taking. In summary, while most cases of dizziness are not life-threatening, it's crucial to recognize the red flag symptoms that require immediate medical attention. Chest pain, difficulty breathing, weakness or numbness, slurred speech, vision changes, and loss of consciousness are all warning signs that should never be ignored. If you experience any of these symptoms alongside dizziness, seek immediate medical help. In the next section, we'll discuss self-help strategies for managing mild dizziness, but remember, these strategies are not a substitute for professional medical advice. Now, let's shift our focus to what you can do to manage mild dizziness at home. These self-help strategies are designed to provide relief from occasional episodes and can be particularly helpful while you're waiting to see a doctor or if your dizziness is related to a known and manageable cause. However, it's crucial to reiterate that these tips are not a substitute for professional medical advice. If your dizziness is frequent, severe, or accompanied by any of the red flag symptoms we discussed earlier, seek medical attention immediately. Point 1 of the simplest and most effective ways to combat dizziness, especially if dehydration is suspected, is to stay adequately hydrated. Aim to drink plenty of water throughout the day, especially in hot weather or during physical activity. Avoid sugary drinks, which can actually worsen dehydration. Carry a water bottle with you and sip on it regularly. Pay attention to your body's signals. If you feel thirsty, you're already slightly dehydrated. Managing blood sugar levels is also crucial for preventing dizziness, particularly if you have diabetes or are prone to hypoglycemia. Eat regular meals and snacks throughout the day to keep your blood sugar levels stable. Avoid skipping meals or going for long periods without eating. Choose complex carbohydrates, such as whole grains, fruits, and vegetables, over simple carbohydrates, such as sugary drinks and processed foods. If you have diabetes, follow your doctor's recommendations for managing your blood sugar levels and be sure to monitor your blood glucose regularly. Certain substances can trigger dizziness in some individuals. Caffeine and alcohol, for example, can both affect blood pressure and inner ear function, leading to dizziness. If you notice that caffeine or alcohol exacerbate your dizziness, try limiting or avoiding them altogether. Similarly, smoking can also contribute to dizziness by constricting blood vessels and reducing blood flow to the brain. Getting enough sleep is essential for overall health and well-being, and it can also play a role in managing dizziness. Sleep deprivation can disrupt the body's natural balance and make you more prone to dizziness. Aim for 7 to 8 hours of quality sleep each night. Establish a regular sleep schedule and create a relaxing bedtime routine to promote better sleep. Stress and anxiety can also contribute to dizziness. Practicing relaxation techniques such as deep breathing exercises, meditation, or yoga can help to reduce stress and anxiety and alleviate dizziness symptoms. Find a relaxation technique that works for you and incorporate it into your daily routine. For individuals with benign paroxysmal positional vertigo (BPPV), a specific set of exercises called the Epley maneuver can be highly effective in relieving dizziness. The Epley maneuver involves a series of head movements that help to reposition the displaced calcium crystals in the inner ear. However, it's crucial to consult with a doctor or physical therapist before attempting the Epley maneuver, as it needs to be performed correctly to be effective and avoid injury. They can guide you through the steps and ensure that you're performing the maneuver safely. There are many videos online that demonstrate the Epley maneuver, but it's always best to have it demonstrated by a professional first. In addition to these specific strategies, there are some general tips that can help you manage dizziness episodes when they occur. If you feel dizzy, sit or lie down immediately to prevent a fall. Avoid sudden movements, such as standing up quickly or turning your head sharply. Focus on a fixed point in the distance to help stabilize your vision. If possible, dim the lights and reduce noise to minimize sensory overload. Finally, it's important to create a safe environment to minimize the risk of falls. Remove tripping hazards from your home, such as loose rugs or clutter. Use assistive devices such as canes or walkers if necessary. Be extra cautious when walking on uneven surfaces or in dimly lit areas. In summary, there are several self-help strategies you can use to manage mild dizziness at home. Staying hydrated, managing blood sugar levels, avoiding triggers, getting enough sleep, practicing relaxation techniques, and performing the Epley maneuver under professional guidance can all help to alleviate dizziness symptoms. However, remember that these strategies are not a substitute for professional medical advice. If your dizziness is frequent, severe, or accompanied by any of the red flag symptoms, seek medical attention immediately. In the next section, we'll discuss what to expect during a medical evaluation for dizziness. So you've been experiencing frequent dizziness and have decided to seek medical attention, a wise decision. But what can you expect during your doctor's visit? Understanding the evaluation process can help alleviate anxiety and ensure you're prepared to provide your doctor with the information they need to make an accurate diagnosis. The medical evaluation for dizziness typically involves a thorough review of your medical history, a detailed description of your symptoms, a physical examination, and potentially some diagnostic tests. The first step in the evaluation is a comprehensive review of your medical history. Your doctor will ask about any underlying medical conditions you have, such as heart problems, diabetes, neurological disorders, or anxiety disorders. They'll also inquire about any medications you're taking, both prescription and over-the-counter, as well as any supplements or herbal remedies. Be sure to provide a complete and accurate list of all medications and supplements you're taking, including the dosages. Next, your doctor will ask you to describe your dizziness in detail. They'll want to know how often you experience dizziness, how long each episode lasts, and what triggers your dizziness. Be as specific as possible when describing your symptoms. For example, do you feel lightheaded, unsteady, or like the room is spinning? Does your dizziness come on suddenly or gradually? Are there any specific activities or positions that make your dizziness worse? Your doctor will also ask about any other symptoms you're experiencing alongside dizziness. This could include headaches, nausea, vomiting, hearing loss, tinnitus, vision changes, weakness, numbness, or difficulty speaking. Be sure to mention any other symptoms you've noticed, even if they seem unrelated to your dizziness. Following the medical history and symptom review, your doctor will perform a physical examination. This will typically include checking your blood pressure, heart rate, and temperature. They may also listen to your heart and lungs. With a stethoscope. A neurological examination is also an important part of the evaluation for dizziness. This will involve assessing your balance, coordination, reflexes, and cranial nerve function. Your doctor may ask you to walk in a straight line, stand on one foot, or follow a moving object with your eyes. In addition to the general physical and neurological examinations, your doctor may perform some specific tests to assess your balance and inner ear function. These tests may include Dix-Hallpike maneuver. This test is used to diagnose benign paroxysmal positional vertigo (BPPV). It involves quickly moving you from a sitting position to a lying position with your head turned to one side. If you have BPPV, this maneuver will often trigger a brief episode of vertigo and nystagmus, involuntary eye movements. Head impulse test. This test assesses the function of the vestibular system, which is responsible for maintaining balance. It involves quickly turning your head to one side while you focus on a fixed point. If your vestibular system is not working properly, your eyes will briefly move off the target before correcting. Romberg test. This test assesses your ability to maintain balance with your eyes closed. You'll be asked to stand with your feet together and your arms at your sides, first with your eyes open and then with your eyes closed. If you have difficulty maintaining balance with your eyes closed, it could indicate a problem with your balance system. In some cases, your doctor may order additional diagnostic tests to help determine the cause of your dizziness. These tests may include blood tests. Blood tests can help to identify underlying medical conditions such as anemia, thyroid problems, or infections. Hearing tests. Audiometry. These tests assess your hearing and can help to identify inner ear problems that may be contributing to your dizziness. Balance tests. Vestibular testing. These tests provide a more detailed assessment of your vestibular system function. Imaging scans, MRI or CT scan. These scans can help to rule out more serious conditions such as stroke, brain tumor, or multiple sclerosis. The specific tests your doctor orders will depend on your individual symptoms and medical history. Be sure to ask your doctor any questions you have about the tests and why they are being ordered. In summary, a medical evaluation for dizziness typically involves a thorough review of your medical history, a detailed description of your symptoms, a physical examination, and potentially some diagnostic tests. The goal of the evaluation is to identify the underlying cause of your dizziness and develop an appropriate treatment plan. In the next section, we'll discuss the various treatment options available for dizziness following a thorough medical evaluation. The next step is to determine the appropriate treatment options for your dizziness, because dizziness is a symptom with a wide range of potential causes. The treatment approach will vary depending on the underlying condition that's identified. There's no one-size-fits-all solution, and the best course of action will be tailored to your individual needs and circumstances. For dizziness caused by inner ear problems such as BPPV, Meniere's disease, or vestibular neuritis, several treatment options are available. As we discussed earlier, the Epley maneuver is highly effective for treating BPPV. In some cases, your doctor or physical therapist may perform the maneuver in the office, or they may teach you how to perform it at home. For Meniere's disease, treatment may involve medications to control vertigo and reduce fluid buildup in the inner ear. These medications may include diuretics, antiemetics, and antihistamines. In severe cases, surgery may be necessary to alleviate symptoms. Vestibular neuritis is often treated with medications to reduce inflammation and suppress vertigo. Vestibular rehabilitation therapy, which involves exercises to improve balance and coordination, can also be helpful. If your dizziness is related to migraines, treatment will focus on preventing and managing migraine headaches. This may involve lifestyle changes, such as avoiding triggers, getting enough sleep, and managing stress. Medications, such as triptans, beta blockers, and calcium channel blockers may also be prescribed to prevent or treat migraines. For dizziness caused by anxiety or panic disorders, treatment will typically involve therapy, medication, or a combination of both. Cognitive behavioral therapy, CBT, can help you learn to manage your anxiety and panic symptoms. Medications, such as antidepressants and anti-anxiety medications, may also be prescribed if your dizziness is a side effect of medication. Your doctor may be able to adjust the dosage or recommend an alternative medication. Never stop taking a medication without first talking to your doctor. In some cases, dizziness may be caused by an underlying medical condition, such as heart problems, anemia, or thyroid problems. In these situations, treatment will focus on addressing the underlying condition. For example, if your dizziness is caused by anemia, you may need to take iron supplements or receive blood transfusions. If your dizziness is caused by a heart arrhythmia, you may need to take medication or undergo a procedure to regulate your heart rhythm. Vestibular rehabilitation therapy, VRT, is a specialized form of physical therapy that can be helpful for many types of dizziness, particularly those related to inner ear problems. VRT involves a series of exercises designed to improve balance, coordination, and gaze stability. The exercises help your brain to compensate for the dysfunction in your vestibular system. In addition to these specific treatments, there are some general measures that can help to manage dizziness symptoms. These include staying hydrated. Dehydration can worsen dizziness, so it's important to drink plenty of fluids throughout the day. Eating regular meals. Skipping meals can cause low blood sugar, which can lead to dizziness. Avoiding triggers. Certain substances, such as caffeine, alcohol, and nicotine, can trigger dizziness in some people. Getting enough sleep. Sleep deprivation can worsen dizziness. Managing stress. Stress can also contribute to dizziness. It's important to work closely with your doctor to develop a treatment plan that's right for you. Be sure to follow your doctor's instructions carefully and attend all scheduled appointments. It may take some time to find the most effective treatment for your dizziness, so be patient and persistent. In summary, the treatment options for dizziness vary depending on the underlying cause. Treatment may involve medications, therapy, vestibular rehabilitation, lifestyle changes, or a combination of these approaches. The goal of treatment is to alleviate your symptoms and improve your quality of life. In the next section, we'll discuss lifestyle adjustments that can help you prevent dizziness and manage your symptoms long-term. Beyond medical interventions, incorporating certain lifestyle adjustments can significantly contribute to both preventing dizziness and managing symptoms in the long term. These adjustments often involve simple changes to your daily routine that can have a profound impact on your overall well-being and your susceptibility to dizzy spells. They're not a quick fix, but rather a commitment to a healthier way of living that can empower you to take control of your dizziness. One of the cornerstones of a healthy lifestyle is regular exercise. Engaging in physical activity not only improves your cardiovascular health and strengthens your muscles, but also enhances your balance and coordination. Activities like walking, swimming, and Tai Chi are particularly beneficial for improving balance and reducing the risk of falls. However, it's crucial to start slowly and gradually increase the intensity and duration of your workouts. If you're prone to dizziness, avoid activities that involve sudden movements or changes in head position. A balanced diet is equally important for preventing dizziness. Eating a variety of nutrient-rich foods can help to stabilize your blood sugar levels, maintain adequate hydration, and provide your body with the essential vitamins and minerals it needs to function optimally. Focus on incorporating plenty of fruits, vegetables, whole grains, lean protein, and healthy fats into your diet. Avoid processed foods, sugary drinks, and excessive amounts of caffeine and alcohol. Stress management is another key component of a dizziness prevention lifestyle. Chronic stress can disrupt the body's natural balance and make you more prone to dizziness. Find healthy ways to manage stress, such as practicing relaxation techniques, spending time in nature, engaging in hobbies you enjoy, or seeking support from friends, family, or a therapist. Avoiding known triggers is essential for preventing dizziness. As we discussed earlier, certain substances, such as caffeine, alcohol, and nicotine, can trigger dizziness in some people. If you've identified specific triggers for your dizziness, make a conscious effort to avoid them. This may involve limiting your caffeine intake, abstaining from alcohol, or quitting smoking. For some individuals, assistive devices, such as canes or walkers, can provide added stability and reduce the risk of falls. If you're unsteady on your feet or prone to dizziness, talk to your doctor or physical therapist about whether an assistive device might be helpful for you. They can help you choose the right device and teach you how To use it safely. In addition to these general lifestyle adjustments, there are some specific strategies you can implement to manage dizziness symptoms when they occur. If you feel dizzy, sit or lie down immediately to prevent a fall. Avoid sudden movements or changes in head position. Focus on a fixed point in the distance to help stabilize your vision. Creating a safe environment is crucial for preventing falls. Remove tripping hazards from your home, such as loose rugs or clutter. Install grab bars. In the bathroom and shower, use nightlights to illuminate hallways and stairways. Be extra cautious when walking on uneven surfaces or in dimly lit areas. It's also important to be mindful of your posture. Poor posture can contribute to dizziness by affecting blood flow to the brain. Stand and sit up straight, and avoid slouching. Finally, staying informed about your condition and actively participating in your care can empower you to take control of your dizziness. Learn as much as you can about your specific type of dizziness and the available treatment options. Communicate openly with your doctor and ask questions about anything you don't understand. In summary, incorporating lifestyle adjustments into your daily routine can significantly contribute to preventing dizziness and managing symptoms long-term. Regular exercise, a balanced diet, stress management, avoiding triggers, using assistive devices, creating a safe environment, maintaining good posture, and staying informed about your condition are all important steps you can take to improve your quality of life. In the next section, we'll discuss the challenges of living with chronic dizziness and offer coping mechanisms and support resources to help you navigate this often frustrating condition. Living with chronic dizziness can be incredibly challenging. Unlike occasional dizzy spells that quickly pass, chronic dizziness is persistent and can significantly impact your daily life, affecting your ability to work, socialize, and even perform simple tasks around the house. It's important to acknowledge the emotional and psychological toll that chronic dizziness can take, and to develop coping mechanisms and seek support to navigate this often frustrating condition. One of the biggest challenges of living with chronic dizziness is the unpredictability of the symptoms. You never know when a dizzy spell might strike, which can lead to anxiety and fear. The constant worry about when the next episode might occur can make it difficult to plan activities or even leave the house. This can lead to social isolation and feelings of loneliness. Pacing activities is a crucial coping mechanism for managing chronic dizziness. This involves breaking down tasks into smaller, more manageable steps and taking frequent breaks to rest and avoid overexertion. For example, instead of trying to clean the entire house in one day, you might focus on cleaning one room at a time, with breaks in between. Planning ahead is also essential for managing chronic dizziness. This involves anticipating potential triggers and taking steps to minimize your exposure to them. For example, if you know that certain places or situations tend to trigger your dizziness, you might avoid them altogether or plan your visits during less busy times. It's also helpful to carry a small bag with essentials, such as water, snacks, and any medications you might need. Communicating openly with family, friends, and colleagues about your condition is crucial for building a support system. Let them know what triggers your dizziness and what they can do to help if you experience a dizzy spell. It's also important to be honest about your limitations and to ask for help when you need it. Seeking support from others who understand what you're going through can be incredibly helpful. Support groups for people with dizziness or balance disorders can provide a safe and supportive environment where you can share your experiences, learn coping strategies, and connect with others who are facing similar challenges. Your doctor or physical therapist may be able to recommend a local support group. Online support groups and forums can also be a valuable resource for connecting with others. Cognitive behavioral therapy, CBT, can be a helpful tool for managing the anxiety and depression that often accompany chronic dizziness. CBT can help you learn to identify and challenge negative thoughts and behaviors that contribute to your symptoms. IT can also teach you coping skills for managing stress and anxiety. Mindfulness meditation is another technique that can help you manage chronic dizziness. Mindfulness involves focusing your attention on the present moment without judgment. This can help you to reduce stress, improve your focus, and develop a greater sense of self-awareness. It's also important to be kind to yourself and to practice self-compassion. Living with chronic dizziness can be incredibly frustrating, and it's easy to get discouraged. Remember that you're doing the best you can, and that it's okay to have bad days. There are many organizations that provide information and support for people with dizziness and balance disorders. The Vestibular Disorders Association, VEDA, is a non-profit organization that provides information, support, and advocacy for people with vestibular disorders. Their website, www.vestibular.org, www.vestibular.org, is a valuable resource for learning more about dizziness and balance disorders. The National Institute on Deafness and Other Communication Disorders, NIDCD, also provides information on dizziness and balance disorders. In summary, living with chronic dizziness can be challenging, but there are coping mechanisms and support resources available to help you navigate this condition. Pacing activities, planning ahead, communicating openly, seeking support, engaging in therapy, practicing mindfulness, and being kind to yourself are all important steps you can take to improve your quality of life. In the next section, we'll briefly touch on alternative therapies for dizziness. While conventional medical treatments and lifestyle adjustments are the primary approaches to managing dizziness, some individuals find relief through alternative therapies. It's important to approach these therapies with caution and to discuss them with your doctor before trying them, as their effectiveness may vary, and some may interact with conventional treatments. Alternative therapies should never be used as a substitute for conventional medical care. Acupuncture is a traditional Chinese medicine technique that involves inserting thin needles into specific points on the body to stimulate energy flow and promote healing. Some studies have suggested that acupuncture may be helpful for reducing dizziness and improving balance, although more research is needed to confirm these findings. The theory behind acupuncture is that it can help to regulate the nervous system and improve blood flow to the brain, which may alleviate dizziness symptoms. Chiropractic care focuses on the diagnosis, treatment, and prevention of musculoskeletal disorders, particularly those affecting the spine. Some chiropractors believe that misalignments in the spine can contribute to dizziness and that correcting these misalignments through spinal manipulation can alleviate symptoms. However, there is limited scientific evidence to support this claim, and chiropractic care for dizziness remains controversial. It is important to choose a qualified and experienced chiropractor and to discuss your medical history with them before undergoing any treatment. Herbal remedies have been used for centuries to treat a variety of ailments, including dizziness. Some herbs that are commonly used for dizziness include ginger, ginkgo biloba, and feverfew. Ginger is thought to help reduce nausea and improve circulation. Ginkgo biloba is believed to improve blood flow to the brain and protect against nerve damage. Feverfew is often used to prevent migraines, which can be a cause of dizziness. However, it's important to note that herbal remedies are not regulated by the FDA and may interact with medications. Always talk to your doctor before taking any herbal remedies, and be sure to purchase them from a reputable source. Homeopathy is a system of alternative medicine that involves treating illnesses with highly diluted substances that are believed to stimulate the body's healing response. There is little scientific evidence to support the effectiveness of homeopathic treatments for dizziness, and many experts consider homeopathy to be a placebo effect. Other alternative therapies that some people have found helpful for dizziness include yoga, Tai Chi, and biofeedback. Yoga and Tai Chi can improve balance and coordination, while biofeedback can help you learn to control your body's physiological responses, such as heart rate and blood pressure. It's important to remember that the effectiveness of alternative therapies can vary from person to person. What works for one person may not work for another. If you're considering trying an alternative therapy for dizziness, it's essential to do your research and to choose a qualified and experienced practitioner. In summary, while alternative therapies may offer some relief for dizziness, it's important to approach them with caution and to discuss them with your doctor before trying them. Alternative therapies should never be used as a substitute for conventional medical care. In the final section, we'll summarize the key takeaways from this discussion and offer some final thoughts on managing dizziness. We've covered a lot of ground in this exploration of what to do if you feel dizzy often. Let's take a moment to recap the key takeaways and offer some final thoughts to empower you on your journey to managing this often challenging symptom. First and foremost, remember that occasional dizziness is common and usually not a cause for concern. However, frequent or persistent dizziness warrants medical attention. Don't dismiss it or try to tough it out on your own. Dizziness can be a sign of an underlying medical condition that requires diagnosis and treatment. Recognize the red flag symptoms that require immediate medical attention. Chest pain, difficulty breathing, weakness or numbness, slurred speech, vision changes, and loss of consciousness are all warning signs that should never be ignored. If you experience any of these symptoms alongside dizziness, seek immediate medical help. Understand the potential causes of dizziness. Dizziness can stem from a wide range of underlying conditions, from dehydration and low blood sugar to inner ear problems, anxiety, and migraines. Identifying the root cause of your dizziness is the first step towards finding effective relief. Practice self-help strategies for managing mild dizziness. Staying hydrated, managing blood sugar levels, avoiding triggers, getting enough sleep, and practicing relaxation techniques can all help to alleviate dizziness symptoms. However, remember that these strategies are not a substitute for professional medical advice. Be prepared for your medical evaluation. Your doctor will ask you about your medical history, symptoms, and medications. They will also perform a physical examination and may order diagnostic tests. The goal of the evaluation is to identify the underlying cause of your dizziness and develop an appropriate treatment plan. Understand your treatment options. Treatment for dizziness varies depending on the underlying cause and may involve medications, therapy, vestibular rehabilitation, lifestyle changes, or a combination of these approaches. Work closely with your doctor to develop a treatment plan that's right for you. Incorporate lifestyle adjustments for long-term prevention and management. Regular exercise, a balanced diet, stress management, avoiding triggers, using assistive devices if needed, creating a safe environment, and staying informed about your condition are all important steps you can take to improve your quality of life. Consider seeking support if you're living with chronic dizziness. Pacing activities, planning ahead, communicating openly, seeking support, engaging in therapy, practicing mindfulness, and being kind to yourself are all important coping mechanisms. Approach alternative therapies with caution. While some people find relief from dizziness through alternative therapies, their effectiveness may vary, and they should never be used as a substitute for conventional medical care. Ultimately, managing dizziness is about empowering yourself with knowledge and taking proactive steps to improve your health and well-being. Don't be afraid to advocate for yourself and to seek out the information and support you need. Remember, you're not alone in this. Dizziness is a common problem, and with the right approach, it can be effectively managed. We hope this comprehensive guide has provided you with valuable information and practical strategies for navigating the challenges of dizziness. Remember to consult with your doctor for personalized advice and treatment. We wish you the best on your journey to regaining your balance and improving your quality of life. In conclusion, remember that frequent dizziness, while often manageable, is a signal from your body that something needs attention. Don't ignore the signal. Your proactive engagement in understanding your symptoms, seeking appropriate medical advice, and adopting healthy lifestyle changes is the key to regaining control and improving your quality of life. We've journeyed through the landscape of dizziness, exploring its various causes, the importance of recognizing red flags, and the spectrum of treatment and management options available. From simple self-help strategies to complex medical interventions, you are now equipped with a wealth of information to navigate this often frustrating condition. The key takeaway is that dizziness is not something you simply have to endure. It is a symptom that can be investigated, understood, and often effectively managed. The first step is to consult with your doctor. They can help you identify the underlying cause of your dizziness and develop a personalized treatment plan. Don't hesitate to ask questions and express your concerns. You are an active participant in your healthcare, and your input is valuable. Remember the importance of lifestyle adjustments. Regular exercise, a balanced diet, stress management, and avoiding known triggers can all play a significant role in preventing and managing dizziness. These changes may require effort and commitment, but the benefits to your overall health and well-being are well worth it. For those living with chronic dizziness, know that you are not alone. Many people experience this condition, and there are resources available to help you cope. Support groups, therapy, and online communities can provide a sense of connection and understanding. Don't be afraid to reach out and seek support from others who understand what you're going through. While alternative therapies may offer some relief for dizziness, It's crucial to approach them with caution and to discuss them with your doctor before trying them. Always prioritize evidence-based medical care and never use alternative therapies as a substitute for conventional treatment. Empowerment comes from knowledge and action. By understanding the potential causes of your dizziness, recognizing the red flags, and taking proactive steps to manage your symptoms, you can regain control of your life and improve your quality of life. Don't let dizziness define you. Take charge of your health and seek the help you need to live a full and active life. We hope that this guide has been informative and helpful. Remember, frequent dizziness is not something to be ignored. Seek medical advice, adopt healthy lifestyle changes, and empower yourself with knowledge. You have the strength and resilience to navigate this challenge and regain your balance. We wish you all the best on your journey to better health and well-being.